if you have someone that's quite ill, let's say, is there any precautions you could go with? Because a lot of people, they know you chelate someone with a bunch of heavy metals and you don't do it right, you're going to cause issues. Yeah. You might actually exacerbate the problem. What about with these remedies?
Well, what makes these remedies so great and so unique is that they're liquid drop dose remedies, meaning you can go very, very low on dosage or very, very high on dosage. You can really run the whole gamut of dosage ranges because they're in these drop dose type of administration. With like a chelator or something like that, you're using milligram doses. You're kind of guessing on the dose as well. And chelators are a whole nother thing we would talk about. But with drainage, they're gentle in that way. They're able to, and because of the energetic nature, they're also very gentle. And so you can really adjust the dosage. What I tell people who I'm not directly working with and one-on-one is if they're worried about a detox reaction, which can happen. Once you start draining the organs of elimination, the body gets excited and starts pumping toxins for circulation for elimination out of the body. When that happens, you can go through this temporary inflammatory phase. And when that happens, you get these, potentially flu-like symptoms, a little bit achy, a little bit, you can develop rashes. You can kind of go through this temporary inflammatory detox phase. Sometimes it's called Herx reactions. And you can have this kind of discomfort. So if you're worried about that, what you can do is then, let's say you just start at 15 drops of the remedy, you can just drop down to 10, drop down to 5, and just stay there. Or what we used to do in school with Precautions remedies is we would start everybody like this. We would just start them on 1 drop twice a day. The next day they would do 2 drops twice a day. Third day, they would do 3 drops, and it would keep increasing by 1 drop each day until they got to starting to feel uncomfortable. Until they started feeling like, oh, I feel like a little nauseous. I feel a little bit of headache. I feel a little bit, getting a little bit of a low-grade fever. Then we say, okay, now drop back down to the drop you were at right before you started feeling symptoms and stay there. Stay there for as long as possible, and then we'll reassess down the line. That's a really great way for patients who are sensitive. Some patients have difficulty with detox. They have genetic predispositions that make them more difficult to eliminate. They're just a little bit more sensitive, and so they kind of require this kind of nuanced approach. That's really easy to kind of administer. A lot of times with chronic disease, as we've seen in clinic, is they need to be on these remedies for a long time. It's not just, they're going to be on for 30 days, they're going to be better. Sometimes they're on for 6 months or longer because the toxic load has been so high for so long and that there's so much degeneration that's happened within the cells, within the organs. We need to decrease that toxic load, and we're not going to do it overnight. And so it takes a little bit of a while before you kind of get there. For a healthy person who's generally doing well, this is actually the perfect time to do drainage because you're lowering the toxic load before you're getting symptoms, before you have that manifestation of chronic disease, which is going to happen later in life. So by lowering the toxic burden now while you're healthy, this is the perfect time to do it. It's hard to convince people to do something preventative in this way, I find. But it really is, if you are proactive about your health, the best thing you can do for your health. And as Dr. Shade was saying, detoxification, all these protocols we're having more and more research showing how it's improving longevity, it's increasing lifespan, it's increasing health span more than anything else, more than these fancy molecules and peptides and hormones. Really detoxifying the person is really going to help them live longer, healthier, happier. And so when you're doing this in kind of preventative way, you can think of it, maybe twice a year. You're doing, a 30 to 60 day kind of cycle once or twice a year to really kind of get the toxic load down as you kind of age and move through life. So these different kind of strategies depending on where you're at.
Yeah, it's interesting how the Germans and Swiss look for those detox side effects as a good sign, right? Because that means, hey, we're pushing, we're getting it out, they're moving. Deal with the headache, it'll go away, right? Keep pushing. In the US, people don't like symptoms. They're like, take it easy, go back a little bit.
Right.
It's just a difference of going about it, and I think cultures.
Yeah, we tend to be a little bit, maybe you could say softer. We don't like fevers, we don't like headaches, and we don't like discomfort. We like take something to stop that. Whereas in Europe, the doctor says, deal with your headache. You're like, okay, I'll do it. Whatever he says, I'll deal with the headache until it goes over. These detox symptoms are not dangerous in any way. A lot of times patients get scared. They're like, oh my God, my Lyme is back. I'm getting worse. But no, it's a phase you have to go through. Inflammation is a phase on the way to health because you've suppressed for so long. Now we unfortunately need to go through a little bit of inflammation in order to get stuff out of the body. So yeah.
It's really like spring cleaning, which we call it, like you usually do spring and fall. Even if you're healthy, that's when I usually do these. And I know my father advised it, you advise it as well, and it goes back to traditional Chinese medicine and the changing of the season and everything. But in spring cleaning, you're making a mess that's worse than what you started with a lot of times. Like I was doing that recently in my place. I'm like, this place looks awful now. Like I'm just giving up, right? And there's just shit everywhere and it's just garbage, right? But that's what you're doing. You're taking the junk out of the drawers, out of that, and you're kind of making a little bit of a cap to get it cleaner. And so, yeah, you go through this change and you're going to have a little bit of a headache doing this. You're going to sweat while you're dragging all this stuff out and everything. But afterwards, you have a much cleaner, much more efficient place to work with.